Hello, I'm Dr. Michelle McGowan.
And I'm Dr.'Henne.
And we are from the Center for Franklin Foot Care out of Claremont, Florida. But now we're available globally via the internet for telemedicine during this time of COVID-19.
So I guess we're going to talk about how we're going to change our office practices over the next few weeks.
So
Rest assured, we are kind of making it up as we go.
I think we're like
we have a
everybody
plan, but we don't exactly know what we're
doing. Making stuff up as we go, just like everybody else, to try and help the best we can. First and foremost, we want to protect our patients that are coming in the office. We want to protect ourselves, our newly homeschooled children like everybody else in America, as well as our office staff. We want to make sure everybody's safe. So what we've done, which is pretty proactive, is we've instituted a curbside check-in for all of our patients in the office. And we've tried to have everybody that is non-emergent reschedule. Do you want to talk about how curbside check-in works?
So what happens is if you're one of our current patients are going to be coming to our office, just like a restaurant, pull up, call the girls up front. If you have a phone, they'll say, okay, they'll call you back. We'll bring you in one at a time, so there's not a bunch of people sitting in the office.
Yeah, so basically what happens is our office is confirming every single patient, and every single patient that's getting called is saying, have you been out of the country in the last 30 days? If you have, we're rescheduling you automatically. Have you had any symptoms? Have you had a fever, chills, temperature of any sort? We're going to reschedule you for about 30 days. And then lastly, we're telling all of our patients, like Tim said, that if you, once you come to the office, we're confirming your appointment's at 8. You pull up to our office at 8, you call the office staff. As soon as there is a sanitized room ready for you, we are going to call you. Do not pass go. Do not stop at the front desk. They're going to bring you right back into a clean room, right?
Yes, and if there's simple things you just need to look at, like we did an ingrown toenail on you, you have a wound, think's infected, we may be able to come out the car and take a peek at you, can take a picture, anything to keep you from sitting in the room with a bunch of the sick people.
Yeah, I mean, especially we treat a lot of limb salvage, wound care type patients. A lot of those patients have multiple comorbidities, but they need to be seen. So we're even telling those patients, if we can see them if we can see them curbside even ourselves, we'll come out. We can protect ourselves and we can protect everybody else. We can protect them, take a peek. If we have to treat something, we can do that. And on a more of a telemedicine, more global side of it, but even for our patients that are local, if you've seen us, and like Tim said, if we did an ingrown nail on you and we just need to check and make sure that you could take a picture, text us. We could do a telehealth visit as opposed to you coming into the office when you don't need to be there.
And there's always ways to get a hold of us. So first and foremost, you can always email. If you're good, no problem with emails. It may take a while going back and forth.
Well, even before you start that, what we have on our webpage, we have available, and I'll put a link to our webpage for setting up a telehealth visit. Because if you want to do a telehealth, it is very simple, and actually it's probably more convenient for most patients because you can actually do it at 5 o'clock at night as long as we're available. We have no problem doing even after hours telemedicine visits for patients. So I think it's going to broaden our what we can do for patients that maybe even our fellow healthcare workers who can't do it during the day because they're some of the only people that are working right now. But yes, we have on our website, and I'll put a link here that basically will say the telehealth visit consent form. If you're a new patient, there's a link to the new patient paperwork as well. And as long as you email that back, even because the president has lifted the HIPAA, you can even take a picture of your new patient paperwork, picture of your information, and you can text it to our office. And then we can set up whether you want to do a FaceTime, Skype. We can text where you text us a picture, we text you back, and then call
email,
you.
Phone call, whatever.
We want to make it as
out.
Convenient as possible for patients.
And if you really need to get a hold of us, we really don't even have an answering system. We've never had one. Nights and weekends when our office is closed, the phone goes to our cell phone. So essentially, everybody has our number. You don't know you have our number. Call, leave a message if there's something going on. We get back to you. Email, text, fax, call the office, leave a message. Either way, we're here available. Even if we can't come in to see you, we can probably figure, because the goal is to keep you out of the hospital. If you don't go where a bunch of sick people are, you won't get sick and spread it around. So anything we can do to keep this down low as possible.
Right. Our biggest fear is I mean, obviously, we don't want to go to the hospital any more than you want to go to the hospital. And some of our fears are diabetic patients with wounds or infections, where it's something we can still handle, whether it is you come to the office because we're not overscheduling. We're not letting a lot of people sit in the waiting room. We don't want you to go to the hospital if you don't have to. If we can treat you, we can put you on antibiotics, we can clean it out in the office, we can flush out whatever, so you can be healthy.
We can send antibiotics. We
Yeah.
can do anything you need anywhere.
I mean, whether it's via the telemedicine or whether it's you coming in because something needs to be done, it is better than sitting in ER or an urgent care, where there's a lot of people right now that are scared and have maybe real big serious problems. And we don't want your problem that's on the foot to go on to limb loss because you were afraid to come in.
And if you have a diabetic ulcer and maybe a small infection, we don't want you to get something else by going where all these other sick people are. Right. So it goes both ways.
Right, but we're all in the same boat. We all now we're all working parents. We're apparently virtual teachers, and we just want to do what we can do that's right for everybody. So again, I'm Dr. Michelle McGowan.
Dr. Tim Henne.
And we're from the Center for Ankle and Foot Care. If you need to make an appointment or you want to make a virtual appointment, our website is centeranklefootcare.com, and our office phone number is 352-242-2502. But
our fax is 352-242-0316, because we're hoping to have all this stuff up and running by Monday. By Monday, hopefully we have this whole system figured out.
Well, pretty much we have. As far as Skype, we can FaceTime, the system's figured out, but it's working and implementing it. We have some older patients. We'll be very patient with you as we try and muddle through this together. If you're from another state and your governor has declared a state of emergency and you can't get out of the house, take a picture, go to our website and we'll help you out as the best we can. We can still write for antibiotics and anti-inflammatories across state lines. So there's a lot of things we can do to help out in this time just to keep you out of the hospital. So good luck to everybody. Hopefully we all stay healthy and, hunkered down as much as we can. And hope to speak with you.
Wash your hands and do the vampire cough. We'll be safe.
All right. Bye.
Bye.